Like, that's dangerous. They're going to be dead before they get back.
Right.
Right? If something is not dangerous, you got to let them do it.
Because it might make them feel better?
No, because they have to come to terms. It goes back to that original point, which is I can't guarantee the outcome. If I had something that was an 100%, I do this and you are 100% good, I would say, you're crazy. Let me do this. There's no risk. I can solve this immediately. Nothing in medicine is that. So if it's not that, I got to let them not, if they need to do something, that's important to them. So there's that kind of those categories, which is, take data, take something that they've found that they just want to do because it's important to them. As long as it doesn't hurt them, you got to let them do that. The second category, which is big, is the stuff we in medicine, Western medicine, don't understand. So it may or may not be real. We don't think it's real. We can mock it. There's no data saying it's real, but it's also possible that it has some benefit. Right. And so we see this a lot with like Eastern medicine, traditional medicines, turmeric. I see a lot of, we get a lot of patients who come in, especially ones from Indian descent. And there's a lot of interesting use of turmeric and kind of some of these spices and stuff that traditionally they used against tumors. Do I think it's going to help? I don't. Is it possible it helps? Sure. I mean, there's a lot of things out there we don't know. And so those things you try to figure out, can I convince this patient to do that in parallel with what I'm doing? Can I convince them that I agree with them that this might help? I've got no data saying it will help, and I know what we're doing has a positive benefit. Can we negotiate that to fit in line with their kind of personal beliefs? And sometimes you get people who say, I got to go try the turmeric thing first, and every once in a while we see it work.
You do see it work.
Every once in a while you see one of these crazy things and you just don't know. And I think one of the things we're learning in all of this stuff around healthcare is that, the old model of cancer gets hit with surgery, chemotherapy, and radiation. Like, we know that works some of the time, most of the time, depending on the tumor, but a lot of times it doesn't. We now have this, the field in cancer is immunotherapy, is trying to get the immune system to tackle these cancers. And we know that people's immune systems are different. And we know that everything you do, what you had in your coffee, does impact the immune system. And so is it enough that it's going to get your immune system stronger to be able to battle this cancer? I don't think so, because if coffee boosted the immune